Hello everyone, I'm Dr. Aishwarya Gupta. I have created this channel to discuss the most important topics for medical entrance examination, including FMGE. This is my first video, and I want to discuss about ABG analysis. So you get around two questions in INI set and one question in NEET PG or FMGE, and you may not get in each exam, but there are high chances that you get in alternate exams. First thing is normal values. So normal value for pH is 7.35 to 45. It is reduced in acidosis and increased in alkalosis. pH is related to H plus ions. So when the concentration of H plus ions is increased, the pH will be reduced. So you can infer that it is inversely proportional. Next entity is PCO2. It is 36 to 44 millimeter of mercury. It is increased in acidosis and reduced in alkalosis. It is a respiratory component, so it relates to the respiratory part of ABG. All right. Now coming to SCO3. SCO3 normal range is 20 to 28 milliequivalent per liter. It is increased in alkalosis and reduced in acidosis. Opposite of what is happening with PCO2, which was increasing in acidosis. Another thing is that CO2 being an acidic gas, whenever it is increased, there will be acidosis. Now, the step you need to follow when you are attempting a question of ABG to come to the right answer. You have to first check the pH. Then, if the pH is more than 7.4, it is alkalosis, 100%. And if it is less than 7.4, it is acidosis. So that's how you rule out. Next step is check HCO3. If HCO3 is less than 0, that is it is decreasing, and pH is also decreasing. That is the change is in inline. All right, like the same thing is happening, then it is metabolic acidosis. Otherwise, if both are increasing, it is alkalosis. In PCO2, if it is increasing and pH is decreasing, ठीक है, opposite हो रहा है इधर, तो ये हो जाएगा respiratory acidosis. And otherwise, it is respiratory alkalosis if PCO2 is less than 40 and pH is more than 7.4. So compensatory response, whenever there is a change in respiratory or metabolic acidosis alkalosis, there is a counter change to balance out the effect. And this will be performed by the other system. Like if there's a metabolic change, then the counterbalance will be by the respiratory system. Coming to the metabolic acidosis, so there is acidosis. So what the body needs to do, it should call respiratory alkalosis. Alkalosis will only happen when CO2 should decrease. For that, you need hyperventilation, so CO2 washout. Opposite in metabolic alkalosis, hypoventilation. Now coming to respiratory acidosis, there is increase in PCO2. So you should increase SCO3 reabsorption. SCO3 when increases is called metabolic acidosis. Now respiratory alkalosis, which is seen in acute mountain sickness. Here due to hyperventilation, there is a CO2 washout. And to correct that, the body decreases the absorption of SCO3. To accentuate this process, we can also give a drug called acetozolamide. One thing to keep in mind is that the respiratory compensation are very spontaneous. They happen immediately, while the metabolic compensation takes certain time because they happen through renal exchange. Coming to Winter's formula, it is used in metabolic acidosis to check for any respiratory compensation. You check the predicted value of PCO2. The value which is given in the question is the measured value, okay, which you get from the lab. This is the predicted value. The formula is 1.5 times SCO3 plus 8 plus plus minus 2. Supposedly in question they have given the value as SCO3 as 16. All right. So in that case, if you multiply it by 1.5 times and add 2, it comes out to be roughly 30. ठीक है एंड जो मेजर्ड वैल्यू क्वेश्चन में दिया गया है वो 40 दिया गया है. So PCO2 is increasing and this is the case of metabolic acidosis where we are checking compensation. For metabolic acidosis के लिए हमको respiratory alkalosis चाहिए, but इधर PCO2 is increasing, is given more, so there is no compensation. So whenever it is more, measured value is more, it is no compensation. Supposedly if it's 28, then body is trying to compensate, so it will be compensation. Body is trying to push to a respiratory alkalosis. Now coming to anion gap, which is a Coming to anion gap, which is the difference between the total positive ion minus total negative ions. Based on that, metabolic acidosis is further divided into high anion gap, that is more than 12, and normal anion gap, that is 8 to 12 milliequivalent per liter. The common causes of normal anion gap metabolic acidosis are drugs, diarrhea, and renal tubular acidosis, and Addison's disease. One thing to keep in mind that most drugs cause normal anion gap metabolic acidosis except aspirin, which is a part of high anion gap metabolic acidosis. Others are ketosis, diabetic ketoacidosis, basically lactic acidosis, and renal failure. There are more causes which you should, look out and remember. Delta ratio, a slightly higher concept, not usually tested, but may be asked because the pattern of the exam is day by day increasing. They are becoming more difficult. So the formula for that is ratio between the change in anion gap and change in SCO3. For change, you have to subtract 12 from the anion gap and 24 minus SCO3 concentration. So the value will come out. Based on the values, it further inferred that if it is less than zero point 0.4, it becomes NAGMA, that is normal anion gap metabolic acidosis. Zero point 0.4 to zero point 0.8, that is high anion gap metabolic acidosis plus normal anion gap metabolic acidosis. If it is between 1 to 2, it is uncomplicated HAGMA. If it is more than 2, there is concurrent disorder. That means there will be metabolic acidosis for sure, or either of the metabolic alkalosis or respiratory abscess. Now coming to this very important graph, which is repeatedly asked, like a pinpoint certain area on the graph, and they will expect you to know what is located there. For example, if we take metabolic acidosis, we check the pHs at the lower side and even the SCO3 ions are at the lower side. So it's very obvious that this area should be metabolic acidosis. Like that, you should know each of them and try to understand. If you cannot, then mug up like simply इसके opposite ये होता है उसके opposite ये होता है कैसे भी करके इसको याद करो because it can be asked and have been asked in the past and you can find it anywhere in the all books. This diagram will be there. Now I have discussed two questions in the end to apply what we read. In this case, the patient's ABG read as pH 7.29, PCO2 as 47, and SCO3 24. How will you interpret? pH is less than 7.4, ठीक है, acidosis. PaCO2 is 47, that is respiratory हो गया, and SCO3 24 normal, ठीक है, normal, but it is respiratory acidosis. So to counter that, it should have increased, no? So there is no compensation. It's not trying to, cause metabolic alkalosis to counterbalance the respiratory acidosis. So respiratory acidosis without compensation. Now, a 25-year-old man presents to the ER with complaints of severe vomiting and fatigue for the past 2 days. pH is 7.2, PaCO2 is 30, SCO3 is 15, and gap is 20. Now, same pattern. pH less than 7.4 is acidosis. SCO3 less than 24 is metabolic cause, ठीक है, and PaCO2 less than 40 यानी कि the body is trying to cause PaCO2 wash out to cause respiratory alkalosis to there is certain compensation present. Now we will calculate using the Winter's formula the predicted PaCO2 to see what is the exact compensation. So when you put the values, the answer comes as 30. And in the question, the measured value of PaCO2 is also 30. So it is inferred that this is metabolic acidosis plus compensatory respiratory alkalosis. So that's for me today, and I hope you guys understood. And I wish that you at least solve 10-15 questions of ABD, and that then you are good to go. And I'm quite sure that you will get all the questions correct in the exam. And bye until my next video. Thank you very much for watching.